You're listening to the Good Morning Scotland Weekend Edition podcast.
Now the first of two special reports. The COVID crisis brought many parts of our public services into sharp focus. We rejoiced in the National Health Service, but were horrified by how the existing structures repeatedly failed our vulnerable elderly in care. So now emerging out of the distress and anger that all of that caused, and is still causing headlines this morning, is the notion of a national care service. But what would that actually involve? Is it really the optimal option, and how would it be paid for? Well, Penny Taylor, the health specialist journalist, is still with us. Penny, this is a massive question. All sorts of governments over all periods of time have been looking at this with no solutions that have generated general public approval. So given what's been brought into focus by the COVID crisis, you've got a couple of special reports looking into Scotland's social care.
Yeah, and it's an absolutely vital part of the public sector. When you think that about 1 in 24 people in Scotland receive some form of social care, you know, that's hundreds of thousands of individuals who are being supported, the vast majority of them to live in the community. Now, we've heard a lot about care homes over recent months, but right across the social care sector, there are really deep concerns about what the future might hold for them. It's such a major issue that we're going to come back to it next week too, so we can explore in as much detail as we can what's meant by that concept we keep on hearing about, a national care service. Now, next week we'll concentrate on the economics of Scotland's social care services, how they're resourced, costed, paid for, and what it might cost to reform them so that they can provide the level of service that people expect into the future. But first, we're going to examine the pressures that adult social care service providers are under to meet increasing demand against ever-tightening budgets. It's important to appreciate just how vast this sector is. It ranges from residential nursing and care homes to a plethora of care delivered in local communities, often one-to-one, to individuals of all ages who need help to be able to live independently. These services are delivered by a complex mix of private, public, not-for-profit organisations of very different sizes. Managing it all is certainly tricky and not helped by the fact that there are massive gaps in the national data. No one knows, for instance, precisely what care is being provided across the country or how well it works. Now, there's no doubt that sorting out this sector and deciding how it's paid for is one of the biggest challenges that our country faces. This week, we're going to hear the views of care providers from right across the board, representatives of the private sector, the so-called third sector, and from an employee-owned organisation in the Highlands. Between them, they care for and support a huge proportion of people who access services. We'll also try our best to untangle what they each understand a national care service to mean, and indeed, whether they believe it's necessary in the first place. But first, let's start by looking at where services are now and what the fears and aspirations are of those who operate, provide and work in them. Annie Gunnar-Logan is Chief Executive of the Coalition of Care and Support Providers in Scotland, otherwise known as CCSP. That brings together organisations which operate in the voluntary, charitable and not-for-profit sectors. CCPS has more than 80 members, which deliver care to around 200,000 people in Scotland, and between them employ around 45,000 staff. These are big numbers. Now, that's about a third of the country's social care capacity, and I asked Annie, what are the main pressures being felt by her members?
Before COVID, I think the main pressure has been the sustainability of social care, the financial sustainability of care. We have a market system in social care in which social care is really viewed as a business opportunity. It's framed all through public procurement, which means that contracts to deliver social care are up for tender in the market. So organisations have to bid against each other, usually, in order to deliver them. And that market is very price competitive. So what's happened, you often hear social care conceptualized as having been engaged in a race to the bottom in terms of staff, terms and conditions and price and so on. And from our point of view, that wouldn't be how I would conceptualize it. I would say that we have been dragged to the bottom by public procurement, which is very price sensitive and in my view is structurally incapable of really assessing quality at all.
What does that mean on the ground, sticking with the procurement issue? What does that mean for the voluntary sector or the third sector or however you'd like to name it?
What it means is that you behave as if you were in a market. So a local authority usually will let a contract and it will invite bids to deliver that contract. So you could have any number of different competitors bidding against each other to provide that contract. And what that contract actually involves and what it contains are hours of care for individuals, whether that's older people, people with learning disabilities, people with mental health difficulties and so on. And sometimes the language of procurement just seems to us to be completely inimical to what we're here to do because people are described as lots. These contracts are described as lots. You know, what would you like to bid for lot one? That seems to me to be antithetical to everything we believe social care is about.
Does it mean that those contracts go then to companies, for instance, that will drive down their cost base?
Well, yes, it does. And that's been the effect of what we've seen over the last decade and more, really. We know that public finances are very tight. We know that there are very significant constraints on public expenditure. And the way that the social care market operates means that if you want to stay in business, you have to remain competitive. And so you have to remain within the funding envelope that is on offer for that contract. Now, if you consider that up to 80% of the cost of a social care service relates to workforce, then you can see where the cuts are going to be made. So over the years, we have seen a very significant downward trajectory in pay, in terms and conditions. And I think that is what the COVID crisis has exposed for everyone to see. But it was going on for a long time before that.
Because I understand that there are organisations, third sector organisations, that have pulled out of contracts because they couldn't afford to pay the rates of pay that they pay their staff, for instance. They couldn't afford to deliver the service for what the money they were getting. Is that the case?
Yes, that's the case. We published research last year on the growing trend for voluntary organisations and charities to hand back contracts, simply because they can't make the numbers add up and they are unable to cut costs to the extent to which they would be able to fit into the funding envelope that the contract is let for. So we started looking at this trend about 3 years ago. We discovered through surveying our own membership that 1 in 5 organisations had in the last 12 months handed something back because they just couldn't do it. It was no longer viable. And they went back to the public authority and said, I'm sorry, we can't do this. You're going to have to find someone else to do it. And subsequently, that went up. That went up to nearly 1 in 4. So that's where we were pre-COVID.
And of course, that impacts directly on the people receiving care, yeah?
Well, it does, because in some cases, these same organisations have been supporting the same people for a long, long time. And so it's very, very difficult for them to walk away. But what can you do if the numbers don't add up? You just can't carry on doing that, because it's either hand the contract back for that particular service or else your whole organisation will fall over. And you certainly don't want that to happen.
Now, you used the sustainability word. I think it was in 2012 that Audit Scotland basically described social care provision as unsustainable. Do you think that remains the case?
It's unsustainable if we don't actually act and do something about it. It's unsustainable to continue the system that we've got, which is driven, as I say, by public procurement and a market dynamic. That is no longer sustainable, for sure.
Campbell Mayer is Managing Director of Highland Home Carers. That's Scotland's biggest employee-owned company, and it delivers at-home support to vulnerable adults living in Highland communities. It has about 500 employees who work right across the patch and who are engaged in the company as joint owners, described as the John Lewis model. Now, this company deals with stresses just as the third sector providers, and I asked Campbell to explain what he feels the main issues are.
I think the principal problems come right back to source, and source in this case, I mean the way in which social care is commissioned through our integrated health and social care system, in other words, through health and social care partnerships. So most care at home social care provision is commissioned on a minute by minute or hour by hour basis. And that drives a race to the bottom in terms of cost and in terms of the workforce. Almost all of the risk associated with that type of commissioning is borne by our workforce. There is no balance of risk between commissioner and provider. And so looking forward, I think one of the top priorities is how we seek to move away as quickly as we possibly can from the historic commissioning processes that, to my view, drive the kind of inequities and the kind of imbalance of risk that we see right across the sector. All of that risk being borne by our workforce.
Apologies for the sound quality on Campbell's interview there. Now, Dr Donald McCaskill is the Chief Executive of Scottish Care, which represents independent social care providers in Scotland. It has around 450 member organisations, including care homes, home care providers and home support providers, mostly working with older people. Between them, they deliver something like 1,000 services to more than 100,000 people right across the country. Donald began by giving me an idea of how he and his members perceive the state of Scotland's social care system today.
The social care sector in Scotland has been in a position of immense vulnerability and fragility for some considerable period of time. The COVID pandemic has highlighted and shone a light on the problems of social care. It hasn't happened during that period of time. So in January, people like me were complaining about under-resourcing, problems with workforce, problems to do with the care and partnership with the primary and NHS sector. So all the problems facing social care now were there in January. So what I think we're experiencing is that at long last, people who were absolutely deaf to our concerns about social care before the pandemic have started to listen and have started to appreciate that the system is broken and it needs repaired. What we are hearing, however, is knee-jerk reaction, often from people who fail to understand that social care is very, very different, for instance, from acute NHS care. So, for instance, the suggestion of a national care service seems to mean many things to many different people, depending on who happens to be using that phrase. And we need to radically reform social care in Scotland, but simple, pithy suggestions with no substance and no sense of what they mean by them do more damage to the debate than contribution. Radical reform, for instance, would mean treating social care as an equal partner, not as a byproduct of the NHS. It would mean resourcing to the sector, regardless of which organisation, to enable terms and conditions which value the work of social care and the workers. So national terms and conditions. It would mean us stopping commissioning for 15-minute visits of home care. It would mean us supporting people better to be independent at home or in a homely setting than we currently do. So there's lots of things which we have been suggesting for a number of years, which a national set of standards and terms and conditions, a national approach to resourcing would enable.
It might surprise some people to know that we have no existing national plan for social care, that there are big variations across the country. Is that the case?
Yeah, it is. But, people have only themselves to blame. in the election in December, which isn't that far past, social care didn't even count in the top 10 subjects of interest, which were motivating voters. So one of the things I think that we need to have a conversation with the wider public about is, what is social care? Because in the last few months, people might have thought that social care is just care homes, and it's not. Social care is about a set of services for people and children who have disabilities, who need support to remain independent, and who need support in order for them to fulfil their human rights as citizens. And that may be in a care home, it may be in your own home, or it may be accessing different services, such as mental health services. So I think the public needs to start a discussion about what is social care. And from my perspective, I think that means understanding that social care is not acute health care. And the way I understand it is that if I am unfortunate enough to have an accident and that requires me being treated in accident and emergency, I'm not overly concerned about who treats me, providing she or he is appropriately qualified. But if as a result of that accident, I require lifelong care and support to enable me to function and be a citizen and be independent, then I absolutely do require choice, control, the ability to have autonomy over those care services. That's the big difference between social care and acute NHS care. That's why a national care service simply cannot mirror a national health service, because it has to have choice. It has to allow me to be able to be in control to the extent to which I'm not as a patient. I need to be in control as a citizen.
Donna McCaskill there made mention of the phrase a national care service. Here's Campbell Mayer again.
I think we need to be very careful as a sector, particularly the independent sector, that we don't react negatively to that. I think nationalising, or the notion of a national care sector, is something that we should consider. But I think before we get to that, I'd rather be in dialogue with policymakers and government around, well, what is it we're trying to achieve and why? Nationalisation, to my mind, is a part of a solution rather than actually discussing the what and why. There may well be elements of bringing things to a national level that actually benefit social care. There's no doubt some of the learning through COVID around personal protective equipment, for example, would support that. I'm also of a view that adopting a national approach to training, learning, accreditation may well have benefit. So I'm not of a view that a national social care system is necessarily a bad thing to do, nor am I of a view that it is the only answer. I think there are a number of options, a number of models, and I'm quite committed, wholly committed, that employee ownership within social care is a part of the solution, not a part of the problem. I would agree that this is not a time for tinkering around the edges of a system that has, for the last 30 years, been tinkered with very little effect and very little change. I think this is a whole system health and social care problem, and a whole system health and social care solution. Ultimately, we should remember that we are trying to deliver health and social care to people as early as possible where they need it and as close to home as possible. That will require a shift in the balance of care, and it will also require a shift in the balance of resourcing. That can only be done with radical interventions at a national level.
From the third sector, Annie Gunnar-Logan gave me her views on what might be good and bad about a national care service.
I think there are some very attractive things about the concept of a national care service. For a start, it would put social care on a par with the National Health Service, which it clearly isn't, and it hasn't been for some time. So there's something about the esteem and the public and political esteem in which it would be held, which is very attractive about it. I think it would give us a sense of there being a clear social contract. We pay tax, this is what we get in return for it. That's very, very clear with the National Health Service, not in any way clear with social care. I think there's a potential to iron out some of the local variations in access and approach. The disability organisations would be very eloquent about this because they've been saying for a long time you should be able to get the same level of support in Dumfries as you do in Durness, and we know that that doesn't always happen. So the kind of national characterisation of this is very attractive in that sense, and I think there's a real potential to come to an agreement at a national level about what social care and support workers should be paid. Some proposals I've seen talk about national collective bargaining for care workers being part of a national care service, and I think that would really be something to aspire to. So those are the good things about it. But for me, there are two things that I've heard that are much, much less attractive and actually quite worrying. One is that some proposals appear to be positing the NHS as taking over social care in some way, or that social care will be absorbed into the NHS. And I think that's really something we should be worried about, because we've spent a long time trying to extract social care from a kind of medical model. And that's really going in the wrong direction, I think. And then the second thing that I don't like about it, and what I've heard about it, is people saying that a national care service would mean that all care and support services will be provided by the public sector, or by councils in particular, with no option for anyone to choose an alternative. That's a real tricky one, because at the moment you've got between 70 to 80% of social care services provided by charities, by other non-profit organisations, or by private companies. So that's an awful lot of transferring of services back in, and that would mean that 70 to 80% of the people currently supported by social care would have some kind of disruption or discontinuity to their service. And the reason why I think this is really important is because if you go back to 2013, there was cross-party agreement for legislation enacted by the Scottish Parliament on what we call self-directed support, which says that people are entitled to choose who supports them and how that support is delivered. So any proposal to transfer 80% of social care away from the current providers would just drive a coach and horses completely through that legislation. There is another consideration to this, which is when you look at the track record of the voluntary sector in particular on quality, you see that quality of care and support is highest in the voluntary sector. And there isn't actually a great deal of difference between the quality of support provided by the private sector and by councils now. So why would you want to transfer high quality support to poorer quality providers? It just absolutely makes no sense.
But what could happen to social care services in Scotland if nothing is done and the current situation is allowed to continue? Can the country afford to postpone a major reform of the sector? There's widespread agreement from all providers that the system must be reformed. Donna McCaskill of Scottish Care again.
If we don't react, then we will see the social care system imploding. It's already very fragile. Care homes in rural and remote areas in particular are struggling to continue. Home care services in some of our cities are struggling because you can get paid more to walk a dog in the city of Edinburgh than you can to care for a human being. So these are fundamentally important issues which we need to deal with in a sense of urgency. And if we don't, the social care system will implode over the next few months and year, and what we will be left with is an NHS unable to pick up the pieces.
The provision of social care is a challenge around the world. Are there viable models that we can learn from anywhere?
So there are models, not least in the Netherlands and Denmark and many of the Scandinavian countries, which evidence a different approach to care and support. Now, some people out there might say all we need to do is get rid of care homes. That would be a mistake, because can I remind people how we used to care for our elderly, particularly when they developed late-stage dementia? We had long-stay institutions and psychogeriatric wards where there was no ability to be personal, no ability to treat people with individuality and with person-centeredness. So we will always need locations which give people dignity until the last moments of their death, who cannot be supported to be independent at home. But there are models out there which we can learn from and can use. But can I mention one thing? They all involve money. They all involve a population which says we value our old and we're prepared to pay for older age, to be dignified and to be humanitarian. Unfortunately, in Scotland, consistently over the decades, we have failed to prioritise the care and support of our older citizens.
That's a view shared by the third sector. Annie Gunnar-Logan again.
What we fear is that social care will become completely unsustainable. We're seeing organisations withdraw already. We're seeing that it's very, very difficult to recruit people into social care because the terms and conditions are by and large so poor. I think if we don't invest in it and if we don't reform it, then we will find that it might actually collapse altogether. And that would be a huge, huge tragedy.
Of course, the biggest issue with anything as big and complicated and important as social care reform is how to pay for it. As Donald McCaskill mentioned there, it will undoubtedly cost billions to reconfigure a system that looks after so many vulnerable people in a way that is resourced, equipped and regulated to support providers to meet their commitments for the decades to come. Next week, we'll examine those economic questions in detail, but in the meantime, let's not get too despondent about the whole thing. We'll sign off this week with a positive message from Annie Gunnar-Logan.
We characterise social care as being in crisis, and in many respects, the system is in crisis. But there are hundreds of thousands of people in Scotland who are receiving superb social care. And there are tens of thousands of people who are delivering that care who really enjoy their job and really want to do it. And that is worth preserving and building on.
You're listening to the Good Morning Scotland Weekend Edition podcast. We're now moving on to the second part of our social care special report. In last week's report, we examined the massive and long-standing pressures on the care sector in Scotland, and from that, the potential advantages and disadvantages of a national care service, which effectively would involve integrating social care into the welfare state. But this morning, we're going to discuss how any fundamental, substantial changes could be funded. So, journalist and health specialist Penny Taylor is back with us once again. Penny, where do we start with this morning?
Well, as COVID has shown us so starkly, Scotland's social care sector is a vital public service. Thanks to the efforts of the country's largest workforce, the sector collectively provides support and care to almost 250,000 people who need help to enable them to live independently or who live in a nursing home or care home. And there are growing numbers of older people requiring that level of care. For instance, dementia is set to double over the next 20 years. So social care is a hugely complex picture with a plethora of services delivered in communities across the country by organisations large and small. Now, before the pandemic, the financial pressures on them were acute. And last week, we heard from people representing a range of care providers who described the challenges that are facing the sector and that were facing the sector even before the pandemic. And they talked about the fragility of the services upon which so many people rely. Now, we'll hear from them again this week as we turn our attention to what Scotland needs to do in order to achieve the high-quality social care we would all hope for ours and us to receive if it came to it. There are some fundamental problems, though. Lack of information is one of them, without which, obviously, it's hard to ensure uniformly high standards. But when it comes to money, things get even more blurry. Around 3/4 of care homes in Scotland are operated by the private sector, which also provides community-based services. However, most care home residents' fees are paid for by local authorities, which also run some services and fund the rest. And then there are scores of so-called third sector providers operating on a charitable, voluntary and non-profit basis. Proponents of a national care service would say that the sector's a mishmash of models that need standardising. However, others believe that a range of approaches and choices serves people best. However, whatever comes next, the question of resourcing is critical. David Bell is Professor of Economics at the University of Stirling. He's been following social care closely and thinking about how to pay for it for some time.
This refers back really in a way to austerity. So over the last decade, the squeeze on public spending has resulted in an unbalanced set of cuts on different public services. So at the UK level, the government decided that it would support the NHS even though its overall budget was declining. So the sector that took the most hit was local authorities. And of course, as I've said, they pay for most of social care. Scotland pretty much followed the UK in supporting the NHS, supporting the resources going to the NHS over that last decade. And it also cut back, but perhaps not quite so severely, on local authority spending. And the consequence of that was that local authorities were unable to support social care in the way that they might have wished, but they had little option given the squeeze on their budgets. And of course, this came through into what they were able to provide in terms of fees for clients in care homes who couldn't meet, the average cost of around £700, £800 a week. The majority of people just are unable to meet that kind of weekly charge.
So what does that mean for those people then? What's the impact on the individual?
So what happens is that the local authorities agree a contract price for care homes, so that the care homes have to accept that price for local authority clients. So it means that a lot of the care homes are running on a shoestring to try to support them. And then on the other hand, those who are self-funded, those who can manage the weekly charge, are perhaps paying over the odds. They may be paying £100, £200 a week more than local authority clients without necessarily receiving any better service.
Do you think that needs addressing?
I think so. I mean, if there's going to be investment in this sector, and it seems to me that is an absolute priority, and if government is unwilling to provide that investment, it seems to me that that can only happen if local authorities are given the spending power to increase the support that they provide for care homes in particular.
Now, in Scotland, we've been hearing talk about a national care service, re-examining how it operates, perhaps even pulling it entirely back into local authority control or whatever. What do you think National Care Service means?
Well, that's a very good question. I've had recent experience of both, and I've got to say that whereas the local authorities, or at least the one, Perth and Kinross, which I was actually involved with, provide an excellent service, there is a need to empower clients as well. So what that means is that local authorities will provide care when they are able to do so. So social care workers will have a list of clients that they have to look after. What that means is that the individual clients themselves don't have that much ability to shape the care that they receive. Local authorities can try to do as much as they can, but it's not possible, it seems to me, under the current arrangements for them to allow clients freedom to determine the services they receive and when they receive them. So there is certainly, for me, an argument that if there is a national care service, there is a pressing need for clients, those receiving social care, to have a very significant say in the services they receive. Now, that might come because they are given a certain amount of control over the budgets that local authorities currently control, or there's some way of joint working that allows greater client say over how resources are to be used. But I think just swallowing up into a service where, in a sense, it's a bit more like the NHS, where there isn't a great deal of personal ability to control what is being received would not be a very appropriate way to go forward.
The inequity that Professor Bell refers to there, penalising so-called self-funders in care homes to meet the real costs of local authority-funded residents receiving the same care, is sometimes called the care tax. Campaigners Scotland Against the Care Tax says it's an underhand way to generate income. They also point out that the fall in value of Scotland's much lauded free personal care since it was introduced in the early 2000s has meant escalating charges for individuals. Annie Gunnar-Logan is Chief Executive of the Coalition of Care and Support Providers in Scotland, otherwise known as CCSP. This brings together the voluntary, the charities and the non-profit organisations that are involved in delivering care. So if social care's current annual £3 billion budget isn't enough, how might it be possible to find more?
There are three ways, aren't there? Number one, you stop funding something else and you fund this instead. We call that prioritisation. Number two, you raise additional income, which means tax. Or, number three, you alter the social contract between government and the electorate and you come to a different arrangement and a different agreement about who pays for what and when. Whichever of those three we do, they are all political choices. This is a management solution cannot be applied to this. These are political choices. One thing I'm very worried about when people talk about a national care service is that for a number of the people proposing it, I think this is what I would call a pre-cooked solution. You know, they wanted certain things to happen pre-COVID, like, you know, nationalisation or taking things back in-house or whatever, and COVID has been now used as a hook to hang that on, and these same ideas have just been trotted out again.
Annie Gunnar-Logan there setting out some of the options for politicians to consider. Now, private providers tend to come in for criticism for profiting from care. But as Campbell Maher, Managing Director of Highland Home Carers, explains, not all private limited companies operate the same way. His business, for instance, is Scotland's largest employee-owned company. Its workers are its shareholders and take a share in the profits. How unusual is that model?
It's extremely unusual in a social care context. Most independent social care providers either operate as private limited companies in a commercial sense or sometimes as charities with a specific purpose. Employee ownership is fairly unusual in the social care setting. What it means for us is that we have part of our core purpose is to effect positive social change in our communities with a particular emphasis of improving the working lives of the social care workforce. And social care is a very unusual environment insofar as we have one very precious and very scarce resource, and that is people. People who choose to devote their working lives to caring for vulnerable adults in our case. And so their working lives are absolutely fundamental to the delivery of safe and sustainable care and support. I guess for me, the question I ask my own board and my own organisation, and I would ask others, is profit for what purpose? So in our case, we are a private limited company. We make profit. However, with us, there's a very strong because after that statement. And the because is that our core purpose is to improve the lives of the social care workforce that's of benefit to all citizens in Scotland and all communities. So profit in and of itself, I don't consider for 1 minute to be an evil. I think where it's important is to understand for what purpose the organisation is making profit. So the concept of shareholder value in our organisation, I guess, is quite different from shareholder value in many other organisations.
Apologies for the poor connection there, but that was Campbell Maher showing how things can be done differently. But so far, there's been no price tag put on the changes that people who work in the sector want to see. Dr. Donald McCaskill is Chief Executive of Scottish Care, which represents independent social care providers in Scotland. It has around 450 members that operate about 1,000 services across the country. He says the potential bill is huge and politically challenging.
So we have an idea of what it might cost, but one of the difficulties, Penny, has been that it's very difficult to find a politician coming close to an election who's prepared to tell the voters what they don't want to hear. And what they don't want to hear, and I'm included in that, is that if we want a quality, dignified, rights-based social care system that treats people the way we want them to be treated, then we're going to have to pay for it. And we've managed for decades, regardless of political party, to buy and purchase care on the cheap. So we're going to have to fundamentally look at how are we going to pay, particularly with an ageing population and a declining work-based population, how are we going to pay for social care? We cannot continue to go piecemeal in the way in which we have thus far. So we're going to have to look at things like a national insurance system. We're going to have to look at mixed models such as in Germany, where you pay additional taxes if you are over a certain age for services that you might use in older age. So there are lots of ideas out there, but we are very aware that we are talking about multi-billion pounds. We're not talking over a cheap fix, regardless of what model you might be considering.
We also need good quality data, though, don't we? There's a massive information gap behind social care in Scotland, yeah?
Absolutely, Penny, because, you don't know what you don't know. And at the moment, for instance, we don't know how many residents there are in Scotland's care homes or where they are. We don't know the level of acuity and need. We don't know how many of the 34,000 individuals in a care home any one evening are living with advanced stage dementia. We don't know how many people are accessing mental health services at different stages in their life, particularly if they happen to be older. So we have huge data gaps. And one of the real positives of the pandemic is that we are working to a degree and speed which would have been unrecognisable before to try to plug some of that ignorance.
Dr. McCaskill's concern about lack of data with which to compare the quality of services is shared by Professor David Bell.
Warren Buffett had the great phrase that when the tide goes out, you see who's been swimming naked. Well, that has really applied to social care statistics during the pandemic. I would say, to be honest, Scotland does a better job than is the case south of the border. But there's lots of things that we do not know about social care. Our health statistics are far better than those that are addressing social care. So one thing we don't know very little about is outcomes. Whether people are happy with the service that they're getting or not. We have an issue around social care workers and care homes. All of these, there are statistics. They tend to be late. They tend to be incomplete. And it's difficult to collect statistics on care homes compared with, say, hospitals. First of all, there are far more of them. They're a disparate group. There's some local authority, there are some third sector, and there's some private sector, and the private sector ones vary a great deal. So the issue of collecting statistics is perhaps more challenging. But nevertheless, before the pandemic struck us, the Statistics Authority, the UK Statistics Authority, was arguing that the quality of statistics available on social care in Scotland was inadequate and needed to be improved. And I think this is particularly true for social care at home, where there is a mixture of unpaid carers, that's often family and friends, care workers who may be self-employed, who may or may not be registered with the local authority, and then the local authority workers and also individual enterprises, which may be profit-making, maybe cooperatives. It's a very, very mixed picture, and that makes it pretty difficult to collect statistics, but there is a pressing need, and I think an understanding at governmental level that this has to change.
Professor Bell also says that there are significant challenges for deciding how to pay.
I've suggested that national insurance should be run on beyond age 65. That is not within the remit of the Scottish Government. Its main instrument of taxation is income tax. It might be able to do something very innovative as far as finding income tax solutions are concerned, but that would almost inevitably be taken up as a political issue. So I guess I'm a little bit pessimistic, but I think if the political leaders could just acknowledge that there's a need to find a solution going forward that is fairer, more equitable across Scotland, then perhaps party differences could be set aside to deal with this very important issue. What has happened in England is a lesson in terms of how not to do it. What was important, and I remember this well, in the introduction of free personal care was that there was all-party support around the issue. What has bedeviled debate south of the border has been politicisation. Arguably, it cost Mrs May her majority at the 2017 election because of the argument that her proposals around capping people's care costs was described as a death tax. So it seems to me that any review, and there is a need for a review, has to be established very carefully, and there has to be discussion among the party leaders around a non-political approach to this very important question.
There are some who believe that making the necessary changes, for instance, to beef up inspection and regulation, that would require legislation, which would take time. But Annie Gunnar-Logan of CCSP says there are important changes that could be made now.
Well, I think there are some quick wins. I'm under no illusion that it will take time, and it should take time to develop a new system, because part of the problem that we've got is that we've kind of raced ahead with some developments before we've kind of properly understood their impact. So it will take time, but I think there are some quick wins. I think it wouldn't be that difficult, actually, to stop competitive tendering in care straight away. I really don't think that would be difficult. What we would need to do is to get the key organisations, and I keep coming back to this, the individuals who use services around the table to see how best they can collaborate and introduce an alternative way of doing things. But they do exist. These things do exist. We have got the building block of social care reform and renewal already on the statute book, and it's called self-directed support. We legislated for it in 2013. In my view, that has never really been robustly and vigorously implemented. And if we did that, we might find that we already had the solution before us. We're always chasing something else. We're chasing the next big shiny thing. We're chasing the silver bullet. But we legislated for this, Penny, 7 years ago. So let's do it properly.
As we've heard, really getting to grips with social care demands cross-party political will. And Dr. Donald McCaskill says that's been lacking right across the UK.
Scotland has established groups and working committees to explore the problem, much in the same way has happened elsewhere in the United Kingdom. So I think it would be false to say that the other free nations of the United Kingdom have solutions just ready to be put into the oven. They don't. They are as guilty of avoidance as all political parties in Scotland have been. And even those who have in Scotland suggested solutions, they are absolutely devoid of any substance because they've not given us the sums. They've not shown us how they would pay for them. They've not shown us how you would keep choice, control and autonomy. They've come up with easy slogans which are absolutely vacuous of any meaning.
With a Scottish election now only a matter of months away, maybe consensus will come. Since the first part of this special report on the future of social care in Scotland was broadcast a week ago, Scottish Labour leader Richard Leonard has said that he's willing to work with everyone who is prepared to support the establishment of a national care service worthy of the name. Consultation on what that means will be taking place over the next few weeks and months. Meanwhile, the First Minister, who promised to end non-residential social care charges at last year's SNP party conference, has said she has huge sympathy for the idea of a national care service and that she hopes that we may see some cross-party willingness to look at it. Social care is also very likely to be a major feature in the programme for government for the year ahead, which is due to be announced in a couple of weeks' time. It's due at the beginning of September. As for the other political parties, the Conservatives' former Scottish leader, Jackson Carlaw, recently told the BBC that he thinks there should be a cabinet secretary with responsibility for the care sector. The Scottish Greens say they want more money for the NHS and better integration between the NHS and social care, while Scottish Lib Dem leader Willie Rennie has called for a strategy that would see more cooperation between Holyrood and Westminster on health and social care policy. Now, given its prominence in the news over the past few months and increasing public awareness of its issues, it's very likely that social care will feature in some form or another in all the political manifestos for next May's Holyrood election. But if it's not to be more tinkering around the edges of what has been described as a broken system, what would Professor David Bell like to see happen?
I think the first thing I would change is the funding. I just think at current levels of funding, it's impossible to set up a service that meets the needs of older people. And I think as baby boomers like me age, they will become increasingly vocal that there needs to be improvement. Now, I think that in terms of what actually the services provided should be, there needs to be greater client control. I'm generally in favour of people being cared for at home as long as is feasible, but probably there needs to be quite a lot of investment in accommodation solutions and some experimentation around these.
So looking at social care in the round goes much further than paying for packages of care. It cuts right across government departments, including housing, and ought to be everyone's concern. Even if you are not presently in receipt of care or have not yet joined the ranks of Scotland's 700,000 unpaid family carers, people who provide invaluable and often unsung support to loved ones at home, COVID has left us all in no doubt that social care is a critical public service that is itself in danger unless it, in turn, receives urgent help.
Penny Taylor. And thanks, Penny. If you want to listen back to any of Penny's special report from this morning, or indeed you missed the first instalment from last week, then you can catch up by searching for Good Morning Scotland, the weekend edition, on BBC Sounds, shortly after we're off air. And Penny, just before you go, how does the public come into all this? Are people thinking about social care more?
Well, it's been really interesting because since last week's broadcast, there's been an awful lot of response to this issue. And, I've heard from very many people who are providing home care, family carers, and people in receipt of care who want to hear their voices reflected in this debate. And I do hope we get round to that. I think we've seen some of that in today's Sunday papers. We need a lot more. As for the general public, I think unless you have been impacted directly, you perhaps don't get the significance of this. And I think it's extremely important that people understand that there's more to social care than care homes, as important as they are, and that there are really pressing issues. For instance, people that had their home care packages taken away or downgraded because of COVID still haven't got them back, and they don't know when they're going to get them back. That's big for families.
It's a big news story for sure. And David Leask, your partner in crime when it comes to the paper reviews, is here and been listening to both of these. I just wonder, your thoughts?
Well, I'm really struck by what Professor David Bell said, this incredible data gap that we've got. And usually in Scotland, we're very good at counting problems. which is the first thing you need to do if you want to fix them. In this case, we don't even know the scale of things, as I understand things.
Yeah. And so at the moment, social care, which is vital to the way the NHS functions, receives 1/5 of the funding. And yet, if it wasn't there, we would find our NHS completely incapacitated by trying to meet the needs of people that are being perhaps neglected in the community as we speak right now.
Thanks for listening. And don't forget, you can catch the programme live at 8 o'clock every Saturday and Sunday morning.